Objection.
Mr. Speaker, over the last weeks, I have spent hundreds of hours helping craft a moderate, centrist bill on health care. Our country should work on lowering the costs of health insurance. And while a nationalized government HMO could prompt tax increases, inflation, and a decline in quality, we could instead enact policies that lower the cost of health insurance for Americans. When we reform health care, we should follow key principles. First, reforms should defend your relationship with your doctor. Insurance companies already interfere with much of our care, and a government HMO would do worse. Second, reforms should reward the development of better treatments and cures. Americans support treating diseases like diabetes, but they are passionate about a cure. And finally, reforms should be sustainable because so many senior citizens depend on them. The worst thing we could do is enact a program that we cannot afford. In considering health care reforms, Americans look to Canada and Britain as models. Canadians have a different view. While over 60% of Americans are actually satisfied with their health care plan, only 55% of Canadians are happy. Over 90% of Americans facing breast cancer are treated in less than 3 weeks, while only 70% of Canadians get such quick treatment. Meanwhile, thousands of Canadians seek treatment in U.S. hospitals. The average Briton waits even longer, 62 days. Britain has fewer oncologists than any other Western European country. It's no wonder Britain ranks 17 out of 17 industrialized countries in surviving lung cancer. The most dramatic differences come in the field of cancer, where Britain's most respected medical journal, The Lancet, published results on a review of European and American survival rates. In short, The Lancet reported American men have a 66% chance of surviving cancer, European men 47%, American women 63%, European women 56%. In short, you are more likely to live if you are treated in America. Newborns most at risk need the care of a neonatal specialist. In the United States, we have 6 neonatologists per 10,000 live births. In Canada, they have fewer than 4. In Britain, fewer than 3. In this country, we have over 3 neonatal intensive care beds per 10,000. Just 2.6 in Canada, less than 1 in Britain. It's no wonder babies in Britain are 17% more likely to die, compared to just 13% a decade ago. The starkest difference appears when you are sickest. In Britain, government hospitals maintain 9 intensive care beds per 100,000 people. In America, we have 3 times that number at 31 per 100,000. In some, Britain has less than 2 doctors per 1,000 people, ranking it next to Mexico, South Korea, and Turkey. Stories of poor care under government-only systems are common in Britain. Last February, the Daily Mail reported on the case of Miss Dorothy Simpson, age 61, who had an irregular heartbeat. Officials of the National Health Service denied her care, telling her that she was, quote, too old. The Guardian reports in June that 1 in 8 NHS hospital patients have waited more than a year for treatment. In Congress, we have proposals to create a new option for Americans to sign on to a government health care plan. Proponents claim that this will offer a choice between their current health insurance and the government plan. That's what proponents say. What they do not say is under many of the major pieces of legislation under consideration, the government health care plan is funded by ending the tax break employers receive for providing health care insurance. This tax break supports health insurance plan for most families, 165 million Americans. Do they know that the legislation being considered will trigger a tax decision by their employer to cancel health insurance for their family, leaving them actually no choice but an untested, brand new, government-only HMO attempting to care for their family? The new legislation also depends on funding from a climate change bill that press reports indicate a number of majority members will not support. Without funding from a climate change bill, there is little revenue except borrowing or printing more money to support new government health care. Seniors and low-income Americans depend on the promises we make. The worst thing we can do is make commitments that are too expensive and pull the rug out from those who can least afford to cope. We should back reforms that the government can afford to keep, and we will be putting forward new legislation on that in the coming days.
Recognize Mr. Jones from North Carolina. Without objection.
Thank you, Mr. Speaker.